The Inland Empire Health Plan is a nonprofit insurer for low-income residents in Southern California. To help improve the overall well-being of its 1.5 million members, the plan started a foundation in 2021. Greg Bradbard is the CEO of that foundation and joins us today to discuss the benefits of iterative processes, the importance of honest conversations between grantors and grantees, and how organizations, especially young ones, must develop a healthy risk tolerance in order to thrive. Welcome to the Science of Good, where we sit down with cause leaders who are disrupting the status quo, tackling our toughest societal problems, and seeking better ways to spark change.
Good morning where you are, and still in California, a little bit of morning left. Glad to have you with us.
Bit left.
So IEHP Foundation there by your name is the Inland Empire Health Program Foundation. And when I did a little bit of checking into IEHP, I thought, wow, a health program setting up an endowment to fund a foundation to help make the communities they serve healthy. That's not just a good deed, that's good business. So really, really, really smart. How'd you come to head up the organization?
Yeah, first of all, thank you for having me today. Looking forward to having this conversation together. You know, my journey, like many, I kind of fell into the nonprofit world. I did initially, this is going back almost 30 years, did my degree in psychology and social behavior. And I had an internship, which resulted in a job for me working with an organization that worked with low-income and homeless families. And I didn't really even know exactly what this whole nonprofit thing was. I remember asking the executive director, so what is nonprofit? Is it business? Is it government? And she explained it to me, and I kind of thought, it seems someplace in between. And I would still say to this day, someplace in between those two. But resulted in a really exciting journey that I've been on, been able to work in a number of organizations, including homeless and housing, education, working in the foster care system. I ran a United Way for a number of years, doing some really rewarding work. And about 2 years ago, I had the opportunity to join IEHP Foundation, a very new foundation. It's only about 5 years old, and really be able, having the opportunity to essentially lift it off the ground and really help to shape with our board of directors who this organization is going to be long-term and how can we make the greatest impact across our region.
Well, wow, what a lengthy resume and what a depth of experience that you have. We're going to get into some bigger themes, but I want to ask this question to get further into learning about your foundation is, what's something about leading the IEHP Foundation right now that people on the outside probably wouldn't expect?
Well, I think, I think many times, and again, I've spent, a couple of decades working in nonprofits and as a fundraiser primarily, right? I mean, as an executive director of running organizations, we say, no money, no mission, no mission, no money. And so a big part of that is not just having the vision and the ability to build the programs and run them effectively, but also to have the dollars to do that work. I think, many times we think, man, I would love to be on the other side. Right. I'd love to be, the one who's given the money out and you'd be on the foundation side. And I think sometimes what people understand is it is a privilege. Absolutely. And it's challenging to do the work effectively and to make sure that you're stewarding your dollars effectively and never feel like we have enough resources to really address the enormity of the issues across the region that we would like to be addressing. So it does take a great intentionality in terms of determining where are we going to put our resources and what are the strategies that we want to undertake.
Interesting talking about people saying, hey, I wish I were on the other side of this thing. Mm-hmm. What's a challenge you're dealing with right now, as a funder? That you think might be common among other foundations that are making grants to nonprofits to do the work?
I could probably share a number of those challenges with you, but one would probably be just kind of philosophically, how we operate or how other funders operate in terms of Are we funding general operating dollars, which every organization needs? Are we funding, capacity building type efforts and really focused on, improving, expanding, deepening the work organizations are doing? Are we funding capital campaigns as well? And I think that that's kind of an ongoing struggle, I think, both on the funder and the nonprofit side, right? How do you find, even as organizations want to increase their, the impact that they're making, and we know funders and boards of directors, because all of us have boards of directors who we report to who want to know that we're making an impact with our dollars. They do want to see what's new, what's sexy, what's innovative, where are we deepening the work? And so then there can be a tendency to, always be looking for the new thing, when the reality is we know organizations are struggling many times just to fund the lights and the ongoing just operational needs of the organization. And so as a foundation, where we've landed, we're somewhere in between, we're somewhere in the middle of that. We do fund general operating with an eye on capacity building. Hey, how do we help you, build capacity? We do like the projects that other funders might not be as interested in, and trying to support that, but also recognize many times you have organizations that do need dollars just for the basics, just to continue meeting their mission.
Well, gosh, having those three distinctions is really helpful perspective. As a younger foundation, you mentioned you've just been around 5 years. I imagine you're having to make decisions that you can't always pressure test, or that you don't have historical precedent to access and inform. How do you try and mitigate the risk that comes with that?
Well, first I'd say, I don't know if we're always that concerned with mitigating risk. I think we're more interested in, hey, what's going to work? And I think I'm fortunate to have a board that's okay with us taking a little bit of risk. So what we talk about a lot is iterative design, right? We say, hey, look, we're going to iterate, we're going to try something, we're going to see what we learn from it, we debrief, we evaluate it. By the way, and as a foundation, we evaluate everything, including everything that, even the programs that we offer. And then we're gonna adapt as we move forward. And I said to one of my board members, as we in the first years we started to launch some activities, I said, I'm really excited about what we're doing, but I said, I'm sure we're not going to get it right the first time, and I'm sure we're going to need to adapt, and we're going to probably look different in 5 years. And she looked at me and she said, I'll be disappointed if you don't look different in 5 years. And I love that. I love having a board who gets it, where it's safe for us to go back and to share, hey, look, we did this thing, it worked pretty well, but here's some things we learned that actually didn't work so well. And here's how we need to tweak it and go in a different direction. So we really do try to be responsive as a funder, responsive to the needs of the community, responsive to what we're seeing. I mean, I'll give you an example. Just, right now, one of the big things that we're following are the changes coming on the federal level from HR1, the federal budget bill, and how that's going to impact things like SNAP and Medicaid eligibility across the country. Very concerned about that in our community and elsewhere. And so that was something that was not directly on our radar a year ago. And today we're saying, okay, how do we lean into that space? How do we make sure that we are finding opportunities to help as many residents in our community to retain their insurance coverage during this time when it's at risk as possible? And then with the community figuring out what those solutions are. But again, I think being nimble and being flexible is really, really critical.
I think it just kind of makes me smile that that iterative design and programming comes up. It's funny how things get planted. I was listening to a podcast this morning, and the hosts were talking about Tim Cook stepping down as CEO of Apple, and how they were talking about some of his biggest successes, and one of them obviously is the iPhone watch. And the guy was saying, I really thought that's not going to be a big flop, but the genius there was he turned it into a health device. He saw the need not just for a cell phone on your wrist, but for something that would track your steps and your all the health dynamics that the watch is able to do, and how that was just right place, right time, and he wouldn't have gotten there without sticking with it and evolving it. So it's kind of neat that would come up in this conversation as well.
Yeah, and I imagine that may or may not have been the initial intent of that product.
Oh,
right?
It wasn't.
that
Yeah.
maybe learned, through, and I'll just if it's okay me to jump on, one of the programs that we launched about 2 years ago, which has been really fulfilling, is something we call our Champions for Vibrant Health Leadership Network. And it's basically a network of 40 organizations, 80 leaders. Each organization is both an executive leader and an emerging leader that is part of it. It's a 2-year program focused on leadership development and public policy work. One of the outcomes of that, probably the most powerful, is not just the training, it's been the relationships between those 80 nonprofit leaders in the region, and the partnerships they're starting to develop now, the ways they're starting to work together. They're doing co-grant writing. And that was an unintended consequence for us.
Yeah.
That was not in the design. There were several objectives. If that was an objective on the list, it was like number 9. It wasn't at the top. And it's probably, I would say, among the top benefits of this group.
Yeah, we've got to have more collaboration. I think there's been historically nonprofits in the same community feel so competitive for dollars, and hearing things about people collaborating and co-grant writing, and that's what it's going to take.
Exactly. Speaking of competing for dollars, we have a great opportunity with having you here to get some insight. So I would love to know, and I know there are other nonprofit leaders who are listening, and if there's one thing you can share with a nonprofit grantee, how can they improve their relationship with funders, that it's more effective, it's more impactful, is that relationship building that you talk about? What would that be?
Mm-hmm. Great question. First of all, well, first I would say just be intentional about building that relationship. I'm amazed how many organizations we work with who I'll say aren't as intentional about building that relationship. And I'll give a couple examples. One is, and I think one of the greatest tools, and I always use this as much as I could when I was running organizations. Invite funders out to see, touch, and feel your mission. If you can, jumping on a phone call is fine. Having a meeting in somebody's office, but if you can invite them out to see your your work in action, is super powerful. One, it could just be a site visit to see where you do your work and be able to do that storytelling to, share the impact you're making and the programs that you're running. Better yet is when you're already running events or when you're gathering people, and your clients are there, when you can invite, a funder in just to be in the mix and just to observe it, or hopefully to hear some of those stories or have some of that interaction with clients, is such a powerful opportunity, and not a tough one. I think it's low-hanging fruit, but it does take intentionality. It does take thinking, okay, we're doing this event, which really I'm focused on my clients where it should be. And are there 1, 2, 3, 4 other, funders or potential funders who I can invite just to join us, just to be there and to see what's happening. Another one I'll say is, and I know some foundations are maybe not as accessible. We intentionally really are a relational funder, and we try to make ourselves very accessible. But we'll fund grants, and we'll send out grant notifications many times to many people who know me, and they have my email address and maybe even my cell phone. And I'm amazed how few follow-up notes I get just saying, hey, thanks so much. We're grateful to continue partnering together. And I will say, when I was a grant writer, or when I was executive director like that, anytime I got a grant notification from somebody who I knew, just that simple, just to say, hey, thanks so much, looking forward to continuing to partner. This is going to make such a big difference for my organization. It's just that stewardship, but it does make a difference, and it does stand out, because you might think, oh, everybody does that, it's not going to make any difference. The reality is many don't. And I think that is one of the ways you can make your organization stand out. One last thing I'll say is I always tried to, even for grants or grantors that don't require an annual report, I would send them an annual report a month or 2 before I knew I was going to be applying for funds again. Make sure that, I was following up saying, hey, look, thanks so much for your support. And here are a few ways that you've made an impact. And here's a picture and a story of one individual life that you've touched through the work you've done. So I think just that follow-up and that communication is powerful. And it's not as common as we might think it would be in the sector.
What I love about that is I hear themes of being intentional. And then I also hear themes, Kevin, of what we were taught to do, back in the day, write a personal thank you card, write a personal note, going back to some of those foundational things that you say a lot of people don't do it. And that really makes a huge difference.
Yeah.
So go ahead, Kevin.
No, I was just going to say we have an apprentice program here. So we have always have a few young people around, and I always tell them, a thank you note doesn't count unless it has a stamp on it. It's just showing my own age.
And I think, man, the art of a handwritten note, right? It's a lost art, which means if you do it, it stands out that much more because it is so infrequent today. Yeah, keep teaching that one. That's a good one.
I love it. I love it. So on the flip side, Greg, what do you think foundations often misunderstand about what it's like to be a grantee?
That's a hard one for me to answer because I started as a grantee. Like that's the world I came from. What do I think funders might not understand? I think a couple things, flexibility, and if the world changes, that I might put in a grant, here's my budget, or here's what I think I need today. But 6 months from now, something's changed, or I learn through that grant period. And I think more grantors today are realizing this. I think in the past, the thinking was a little bit more, is it going to be frowned upon if I report back to that grantor that I didn't use the dollars exactly as I said I was going to use them? Whereas I think that's just the real world, right? Things change, and that flexibility is needed. So I think it's really important for funders, and I think many do today, to recognize that and to be flexible. I will say from our standpoint, what I always say to organizations is, as we're doing site visits, we're having conversations, I would love to hear the good stuff and your successes and how you're making a difference. But what I really want to know is, where are your pain points? Like, where are you challenged? Because that's where we can really help you as an organization. And I actually find that's more beneficial. I also think as, for those who are seeking funds, one of the things that I've learned, and I'll just say, early in my career, I felt like I had to get it all right. And when a funder asked me a question, I had to have the right answers for them every time. Later on, I realized, what, the more transparent I was, the better relationship I actually developed, and the more that funder could help me. When they asked a question where I go, you know what, that's actually something we're struggling with. We haven't figured that one out. As a matter of fact, that's something I'd love to address, but I don't have the funds to do that, properly. That's a place that funder can go, well, cool, I might be able to come alongside you and help you actually address that. And even if they can't, like I said, I think that transparency goes a long way.
Yeah, I mean, that's just authentic communication. So I'm interested, as a former grant seeker and a current grant maker, have you done anything differently from the traditional grant application process, or have you thought about that? It's an onerous thing, and it creates a lot of work for everybody. Any thoughts on, does it need to stay the same? Does it need to change? How might you do it differently?
Yeah. So and you probably know, there's a lot of talk today about trust-based philanthropy.
Yeah.
And, trust-based philanthropy is really, we have some foundations, locally or in Southern California that are significantly reducing the burden on the front end to nonprofits. Where literally there's one or two who are going to, you can make a video submission. You're not even submitting anything in writing.
Wow. Now
there's others of us, like for me, I run a foundation that's a separate 501c3, but it was founded by a public health plan. And that means that you have board members, both my own board members and on the public health plan side, that want accountability and want to make sure that we're doing our due diligence, which means my team has to, have a higher level of due diligence, and we still have to ask for a good amount of information. We do seek to make it as understandable as possible, and also to be really transparent with like our rubric and how are we evaluating. And I think for grant seekers, my advice would be, make sure you read those things, because we're basically telling you exactly what we're going to be looking for. So that tells you exactly what you need to include in your grant application. But Kevin, go back to your question. I don't know that we've done a whole lot on the grant application side, but I would say in the design in terms of what we're doing does come from some of the areas that as a leader, I wish that I had. And one of those is like that leadership network that we developed. I would have loved to be invited into a room with, a large group of other nonprofit leaders from the sector and be, given that leadership development training, the public policy training. Public policy is an area that we've really leaned into because we realize we can put dollars into a nonprofit's mission. But even more powerful is if we can build the public policy muscle of these leaders in our region and train them to be able to lift their voices for those who they serve, for the issues that they care about, issues that are critical to our region. That's going to have a multiplication factor, in terms of the impact for our region. And what we're seeing is by taking these leaders to Sacramento, and in the future we plan to take them to DC, that the policy change is many times much more powerful than the work that they're doing on the ground. Because sometimes we have nonprofits, as we know, we're working to, I won't call it a Band-Aid, but we're addressing the symptoms of a problem. Whereas really, where the problem stems from a systemic issue. And really our time would be better used putting into policy change on the system side that then might at least reduce some of the need for us to be responding kind of on the ground.
Yeah, get upstream of it.
Exactly.
We talked a little bit, and we had some good comments on this earlier. We talked about the upfront, the grant seeking and the grant application, and you have very sound business reasons why it has to be a certain way, and the more traditional way. The other onerous side of this for grantees is the reporting on the back end. And I would imagine that your foundation, for the same reason it requires thorough vetting for the application process, probably has thorough reporting requirements. And I think it's just helpful for any grant-seeking organizations that will be listening to us that, hey, there's a reason why these things are in place. But anything, and you've also commented about you want to know and understand not everything is a success, not everything went perfectly. What can we learn? So obviously wanting to hear the good and the bad side of the reporting equation. Anything else you want to comment there? Because that's something that's always in the back of our minds is, how is this going to look, and will we be recognized as good stewards of these funds and look to again?
No, I think on the kind of the evaluation reporting side, and even programmatic outcome side, I mean, I would advise every organization to build a set of outcome measures that they're measuring on an ongoing basis for their organization that they can hopefully then apply to a whole range of different grants and different funders' requirements. Because I think what you don't want to do, obviously, is every time you have a new grant, have to put a new measurement tool in place for that particular grantee. And I do think it's possible to say, hey, look, we have 6 measures, in place that we're going to measure on an ongoing basis. It's a regular part of our operations and our, programs. And then I have that data available. So when whatever the report is, there's going to be some piece of that is likely going to align with the requirements of that particular funder. So that would be one piece, just in terms of, I think, on the front end, being prepared for better reporting. My other comment would be really what I said earlier is, don't feel like you have to, that it has to be just reporting successes. I think reporting the successes is important. Of course, every funder is going to want to know how you're making a difference, but also including some of that transparent, feedback and sharing where the challenges are as well. I think goes a long way, because I've definitely read grant reports where, or even in a grant application where we ask, what challenges do you anticipate? The answers are kind of weak, right? It's like people, feel like they have to say something, but don't really want to say anything.
Yeah.
I would say, particularly on the back end, take that opportunity to share, like, here is the challenge and here's what we'd like to do about it. and would love to have a continued conversation about that. Use it as an opportunity to continue that relationship, and even for the next step in what that relationship with that funder might look like.
Cool. Thank you. That'll be helpful.
Greg, you really shared some really powerful strategies. And so I saw on your website that one of your programs uses the collective impact model. So what's been harder about that than people tend to assume?
Yeah, collective impact, as most people, hopefully know, is a model that goes back, I don't know, a decade or two at least. It really focused on how do multiple sectors come together, or multiple players come together to address large scale problems, and having a shared vision and shared metrics and aligned activities and so forth. It can be really powerful. It is also really challenging because you're bringing together organizations, even if they agree on what that big picture goal, or right now we're working on what we call a North Star. We know every organization has its own mission, it has its own needs, and sometimes competing interests as well. So I think it is, really getting organizations in the room, not so much to agree on what the big picture goal is. I think that's maybe the easy part. It's then, how is it going to happen, and who's going to play what role, and how do we make sure that everyone plays nice together, especially when there are dollars involved.
Mm-hmm. So going a little further on the collective impact, let's talk about why do you think it hasn't scaled, and what's really needed in order for it to work and be embraced by other organizations?
You saying collective impact across the nation, or
how you see it across the nation? Yeah.
Yeah, it's hard. It's hard. So I will tell you, we're actually working right now with a number of other partners on a 2040 regional health goal. So essentially a 15-year regional health goal for the region. And we had a meeting with a group of stakeholders, about 30 all kind of community leaders, CEOs in the room, and had a great conversation. And I commented to someone at the end of it, and said, this is exciting, but I said, we have a lot of hard work ahead of us. And she said, well, if it wasn't hard, it would have already been done. And I think that's exactly right. And what she said is, the easy stuff's already been done, so the only stuff remaining is the hard stuff. And I said, you're exactly right. I didn't really want to hear that, but you're exactly right. I think collective impact, it's hard, right? It's much easier to do it yourself, to try to do it yourself. What's the old proverb that says, if you want to go fast, go it alone. If you want to go far, do it together. And so it's slower. It's a much slower process. It's hard. It can be politically challenging, but I also think in the long run can be much more effective.
Awesome.
I hope to see it gain some more traction. I worked with a collective impact, an organization that was modeled on collective impact principles, and boy, was it challenging, but we did have some great outcomes in the end. But it took a significant amount of time, and it took a significant investment. But anyway, hope to see more of it in the future. IEHP funding the foundation, I kind of, when we kicked off, I said, that is so smart. That is just good business. Do you see that type of model where you've got a for-profit entity who's going to spin off a nonprofit that will make their business better and stronger? Do you see that trend? That seems a little unique to me. Is that something that the number of your peers going to grow?
I would love to see that trend grow. And obviously there's different types of organizations that launch foundations. In this case, it's a joint powers authority, which IEHP is. But part of IEHP's mission is to develop what we call vibrant health across the region. And that's overall physical and mental health for everyone across the region, not just those who the health plan insures directly. And so they had that vision and knew, hey, look, exactly your point, Kevin, we're going to be more successful if we have an environment across the region that encourages health. And IHP's mission is much bigger than just health. It's actually to inspire and heal the human spirit. And so there is, in the culture at IHP, there is a sense of responsibility to do what's right in our community and to further health across the entire region. We know we do have other companies that we see corporate foundations, right? And others. And I think we know there's different reasons why those foundations are established. Many times it could be, it could be a financial reason. It could be, public relations and, more from a marketing standpoint, that kind of thing. But I think particularly in the health arena, if there's healthcare organizations that recognize we are not going to significantly improve community level health outcomes simply through clinical interventions or through clinical care alone. And we know all the research tells us that the social determinants of health make up about 80% of one's health outcomes. It's not what happens in a doctor's office or in a hospital. It's what takes place in our homes, in our neighborhoods, in our communities. It's social, environmental, behavioral. Those things impact our health to a much greater extent than what happens in a doctor's office. So if I really care about the health of my community and of my clients, I know I can't wait until they reach the doctor's office. It's what's happening in their community that's actually going to have an even greater impact on that.
Right. Well, when we started off, you shared that IEHP Foundation is young, 5 years old. Wow, that's 5 years of breakneck changes. Still, 5 years ago, we were still dealing more so with COVID than we are now. And there have been a lot of political changes, a lot of policy changes. And it looks like it's not going to be a time when things are stable or back to normal again. I don't think there's a new normal. I think the new normal is just everything is uncertain. So it's hard to make predictions. But over these past 5 years, has there been one change or one thing that rises to the top as far as maybe I wasn't expecting this, but I learned from it and the organization grew from it?
That's a great question. And like I shared, I've really just been there 2 years, and really the real work of the foundation just started about 2 years ago. So it's, we're in like year 3 right now. So we are learning a lot. I will say, not say I'm surprised by this, but there's definitely a need for the work that we're doing, and we're definitely not a simple grant maker. We also do, we host what we call vibrant health forums, which are basically workshops on various topics, that kind of thing. I would say what we're experiencing now is recognizing that our vision for impacting the community is much greater than the resources we have available to actually address or to produce and reach that vision. And so that's going to be the challenge, I think, moving forward. Is maybe it's refining our scope, right, and narrowing, because realizing that some of the things that we have enjoyed doing and that we see as being impactful, like every good organization, we're probably going to need to really evaluate, okay, what is the best use of our funds? And that might mean, going back to the iterative design, that might mean some things that we've done that have been a nice to have might not be at the top of that priority list. And there might be some other things that we go, this is actually of greater value and need right now. And that's where we need to place those dollars.
Well, I think anyone watching or listening to this can relate to that scenario.
For sure. Greg, you have been so insightful in what you've shared. And reason why we started the Science of Good is really to provide encouragement and hope and really direction to other nonprofit leaders. And your conversation today has certainly done that. But one of the things we also do is we allow our previous nonprofit leader to pose a question to the next guest. And so the question for you today is, what is one way you stay focused on the good?
Getting out of my office and out into the community. It's getting out on the ground. I would say my best days are when I'm not in the office. It's when I'm with the people, right? So whether that's with our nonprofits, it's being at an event, being on the ground. I feel like that's how I can really keep a pulse on what's really happening out in the in our community, good and bad. And I'll say the same thing was true when I was running an organization, running programs. I knew that I needed to get out. The organization I ran previously was an affordable housing organization, and we offered social services at over 100 different properties throughout California, Florida, and Texas. Getting out to those properties, seeing my staff out there to understand what they were experiencing and what they were hearing, what was, what were the pain points were, but also getting to see our residents and getting to talk to those residents and hear what are they experiencing, how are they doing. That would inform me to go, hey, look, here's something we're not paying attention to that we need to pay attention to. So I would say getting out of the office, out into the community.
I love it. So my question to you, what would be your question to the next nonprofit leader?
What do you think we need to be doing differently 10 years from now than we're doing today to address the emerging needs that are going to be much more prominent 10 years from now than right now?
Powerful question. That's a good one, Kevin.
Yeah, absolutely. And it's smart because right now, all of us are there's been so much change. The immediacy of responding to that and reacting to that is essential, but it's also important not to take your eye off the long game and try and think about how much our world is going to change, is changing now, but thinking a little further out through things like AI and how business will change and employment will change and education will change. So we need to think big about some long-term goals, and as well as addressing the things that are in the here and now. But Greg, this has been a great conversation, and I really appreciate you joining me and Rashonda, and I appreciate all you're doing to help people.
Thank you for having me, and thanks so much for the work you do. And I really believe that the nonprofit sector is an incredible opportunity for us to make such an impact across our communities and our nation. And thank you for investing in those nonprofit leaders.
All right, terrific.
Thank you, Greg, for being a continued believer in good. Thank you. The Science of Good interviews support the work of For Goodness Sakes, a communications firm that uses behavioral change principles to help nonprofits and government agencies advance social causes. Learn more at fgsakes.com.